ways you cannot get HIV. You know something, the toilet seat has been accused of spreading all kinds of diseases. I don't know, when we were coming up, one way to end up with gonorrhea was on a toilet seat. It said, can you get AIDS from a toilet seat? No. Am I right?
Right.
Can you get HIV, I should say HIV, can you get HIV from eating foods prepared by someone who has the virus? All right. Can you get HIV from hugging or touching a person who has the virus? When I was on rounds at Mount Sinai, and we were just getting patients who were HIV positive, we had all these, you had that gown up and all this kind of stuff. And people weren't too thrilled about going into the patients with HIV and take care of these patients. You have to understand, this was in 88, 89, where we were still learning a lot about this illness. The first thing I would do is go in and shake the person's hand and say, I'm Dr. Haynie. Now, why do you think Dr. Haynie shook this person's hand?
To show everybody else that you can't do that.
If Doc's going to shake the person's hand, and if I'm the teaching attending, they feel that I got some, I know exactly what I'm doing, then what that does is it lowers the stigma to these folks shaking their hand. The other thing I would ask the patient, I would say, how do you like the food? And they said, it is terrible. I said, what would you like? And this one patient says, you ever been up to everything and then some? I didn't know where that was.
Yeah.
I said, well, where is it? It says, up on Euclid. I said, well, how far? He said, just keep going up on Euclid. I said, what do you want from there? He said, they make the best liver and onions. So I went up to everything and then some and got 2 dinners. One for the patient and one for me. And we broke bread as I took a history. Did that for a reason. So I'm sitting there taking my history and we sitting there eating, So that, because I know that if this person feels better about the illness, see, one thing about working in the hospital, if people feel better about their illnesses and they think they're going to make it, guess what? They do much better. All right? If it's gloom and doom, they don't do as well. So my whole thought was I could help bump this person 2 CD4 cells by breaking bread. I know that may be crazy. But now this person is saying, well, I got a tough illness, but I am not going to spread this by sitting down breaking bread with this patient.